Have you ever wished that when you went to your doctor for pain, they gave you better options than pills, surgery, shots, or rest? In this video, I'm giving you 3 important tips to make sure that the next time that you go to your doctor because you're hurt, you help them help you the best way possible. I'm Dr. Sean Pastuch, the founder of Active Life. I was a personal trainer since 2005, and I was a chiropractor for almost 9 years, having worked with Olympians, professional baseball players, CrossFit Games champions, and people of all different walks of life. I decided that I had more fun and was actually more effective, helping people with exercise advice, mindset support, and all of the mentorship necessary to guide them through the transformation that they were looking for, no matter where they were in the world, than I was in adjusting and doing soft tissue work in my office. Now, I'm here to bring you the same kind of information and support that I gave my patients and clients for the last 20 years. How did we get here, where doctors are just prescribing pills, shots, surgeries, and copious amounts of rest instead of what you actually want them to give you? I'm going to share it with you really simple. Most people are not like you. Most people go to the doctor and they want the doctor to just give them the solution. They don't want to work and be a part of it. And after years and years of 95% plus of their patients coming to them asking for a simple do-it-for-me solution to their problems, doctors forget that people like you even exist. And even when they know people like you exist, it's risky to offer the patient in front of them lifestyle opportunities to change the way that they're feeling when most of the people are there because they want the pill, the shot, the surgery, or the excuse to not do the regular stuff that they're going to do. That doctor has to run a business and do the best by most of the people who walk in that door that they can. If those people don't want the lifestyle change, it's not in their best interest or the doctor's to try and force it down their throat. Instead of getting frustrated that your doctors are offering you quick solutions that are uninspiring and against everything you want to do with your life, keep in mind that that is what most people want.
Sometimes the best gift is the gift of never seeing you again.
You need to give your doctor the license to treat you the way that you want to be treated, and then trust them to do that. If they're incapable or uninterested in doing that, well, then you got to find another doctor. We'll talk about that in this video too. Let's get into it. Tip number 1. Make sure that you are working with a doctor who shares your values. Your doctor should also be living an active lifestyle. It's going to be very difficult to get the advice on how to live an active lifestyle in a healthy way from a person who isn't doing it and isn't interested in doing it. So how do you know if your doctor is someone who is interested in living an active lifestyle or not? Well, the first thing that a lot of people might tell you is look for a doctor who looks fit. Your doctor is jacked, they work out.
Wrong, 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 wrong.
That's stupid. A doctor who does value the kind of life that you want to live, who maybe went through a period of their life just like you or just like a million other people in your area, where they prioritized their career over their physical fitness and then realized, oh man, I'm living in a way that I wasn't meant to live and is now on their way out of it. That's a doctor who can better relate to a person who is maybe trying to make changes in their life too. You're not looking for somebody who's perfect. You're looking for somebody who aims to be perfect and understands that they're flawed. Accept them for their flaws, but make sure that they want to be an active person and that they're actively pursuing it right now. There are some really simple things that you can do to make sure your doctor lives an active life. You can ask them what their workouts look like right now. You can ask them if they have any good hikes that they've been on lately. You can ask them where they've gone on vacation and what they liked about it and start to make judgments about, are they going to places that they can just sit in a beach chair? Are they going to places that they enjoy seeing this? What do I have things in common with my doctor? That's what you really want to know. Be conversational. Think of it like dating, but on an uncomfortable table with a bunch of that crinkly paper and it's a little colder than you'd like it to be. My primary care doctor moved her practice right here to Long Beach because she values the opportunity to be outside in nature at the beach and all of the physical activity that this town lends itself to. She even opened a gym here. She owned the gym. I know that my doctor values living an active life. She exemplifies it in everything that she does. If your doctor isn't making it as obvious, they don't have to buy a gym to prove that they like to exercise. Simply ask the questions that I shared with you a little bit earlier. This might surprise you, but your urgent care in your town, that's not your primary care doctor, and I believe you should have one. If you don't already have a primary care doctor, you can interview offices. You can call the front desk and you can ask them questions about how that office values treating patients. You can tell them, I'm a very active person. I want to stay very active. Will the doctor help me with things that are not prescribing pills all the time? Is the doctor active? Is the office staff active? What do you guys do? You can ask these questions. The office that you want to be at is going to want to answer those questions. The office that you don't is going to give you this cold shoulder and they're going to complain about you when they hang up. But that's not your office anyway. Tip number 2, when you show up to your doctor with symptoms or even on your first visit, make sure that you and your doctor are clearly aligned on your goals. Make sure that they understand what you want to get out of being their patient. I recommend you do this in all aspects of your life, with your wife, with your husband, with your boyfriend, with your girlfriend, your friends, your coworkers, your boss, your employees, whatever. Do it everywhere. Make sure that everybody understands the vision for what we're doing here, but especially when you're in the office with your doctor. Make sure that they know what you want to get out of being their patient. You don't just want to get out of pain, and you don't just want to improve your blood markers. You want to get out of pain and improve your blood markers by pursuing a lifestyle that you're excited to live. You have to be able to describe what that lifestyle is. The reason it is so crucial to make sure your doctor understands your goals, especially when you're in pain, is because most doctors are uncomfortable helping patients in pain.
What?
I know that sounds crazy, but this study is just one of many that proves it. In this study, only 34% of doctors who treat people in pain report being comfortable that they know what to do with them. That's a staggering statistic. But the next one's going to be even crazier for you. 57% of the same doctors believe that they are the one who should be the first person that somebody in pain comes to see. They should be the one handling the case. You might be asking yourself, how do those two numbers line up? Well, it's because the doctors, despite being only 34% confident that they know what to do with you, they are less than 34% confident that anybody else knows what to do with you. Credit to them for trying, but you might want to be careful to make sure that they actually know what they're doing. The way that you do that is by making sure that they can repeat to you in their own words what your goals are. In a moment, I'm going to explain to you exactly how to explain your goals. First, I want to give you a quote. Pain is the most common reason a patient sees a physician. For most patients, the duration of pain is short, Dr. Hobbs says. Unfortunately, for some patients, the pain never goes away. It's these situations that present physicians with their greatest challenge, since few are formally trained in effectively managing pain. Dr. Raymond Hobbs, Henry Ford Internal Medicine. The reason why this quote matters is because it obviates that doctors don't know what to do with you when you come in chronic pain. And 55 million Americans every single day, and 20% of people in the developed world where the statistic is measured, wake up with pain that they've tried to resolve for months or even years without success. It's totally reasonable to think, I'm finally going to go to the doctor for this, and they'll be able to solve it. But the doctor has no idea what to do with it. They need your collaborative support to help guide their decision making. And you're going to have to be patient because they really don't know what they're doing. I want to keep sharing stuff with you guys so that you can understand how important it is that your doctor wants to help you but doesn't know how. There was a study done of 383 medical schools where they looked at the amount of pain inclusion in the curriculum to teach the doctors how to work with patients. I want you to guess, out of 383 medical schools around the world, how many of them had curriculum dedicated to helping people get out of pain and manage people who are in pain? You have a number in mind? Say it out loud. Was it 14? I bet it wasn't 14.
Okay, a simple wrong would have done just fine, but...
But 14 is the answer. There are 14 schools around the world. Here's the study. Go ahead, look at it for yourself. And I don't want to mix numbers here, so I'm pulling them right from the study. When they do teach doctoral students how to manage and treat chronic pain, here are the number of hours across the education. In the entire curriculum in Canada, 20 hours. Australia, 20 hours. 13 in the UK, 12 in Europe, and 11 in the United States. That's over like a 6,000 hour education. Let me go through those numbers one more time. 20 hours in Canada, 20 hours in Australia and New Zealand, 13 hours in the UK, 12 hours in Europe, and 11 hours in the United States throughout an entire medical school curriculum. Students go to more than 11 hours of class over a 2-day period in any given week. That's the total number of hours they spend in their entire medical school career learning about pain. That's staggering. And finally, in this study, only 35% of you feel confident that your doctor knows how to handle the pain that you're dealing with. So it all makes sense. Now I'm going to teach you exactly how to share your goals so that they can help you achieve them. Stop saying, I have back pain when I lift weights. Stop saying my Achilles hurts when I run. Those aren't telling doctors anything except for what you're feeling. They're not telling doctors what you want. When you do that, it affords a doctor the ability to say, well, if it hurts when you lift weights, stop lifting weights. If it hurts when you run, stop running. Or wear this orthotic. Does that make it feel better? These are options that are on the table unless you tell your doctor how you want to get out of pain. What I want you to do instead is this. Tell your doctor, my back hurts when I lift weights, and I want to lift weights for the rest of my life. Can you help me get out of pain without medications, shots, surgeries, or copious amounts of rest? You need to be able to give them, I want specifically this, without specifically this. And then you're putting the doctor in a position to make a specific decision about whether they believe they know how to help you do that. Much more helpful than my back hurts when I X, and I don't want my back to hurt.
I broke my back.
Instead of saying, my Achilles hurts when I run, we need to say, my Achilles hurts when I run, and I want to be able to run. How much? Share how much you want to be able to run. And you want to get better without share what you want to avoid in your treatment. So, I want my Achilles to feel better when I run, and I want to run 20 miles a week, for example. I don't know why you would want to do that, but people are crazy. Maybe you're one of them. Without wearing orthotics all the time, without shots, without surgery, and without taking 6 months off. These are simple things for you to be able to write down before you go into your doctor's office and to read. You don't have to have it memorized. It's not a test when you get there. You have to tell them specifically, I want this, I don't want this. And finally, tip number 3. I need you to be clear with your doctor about the kind of ongoing support that you think you're going to need to be successful. Your doctor is going to tell you what they think you need to do. We've already established in tip 1 and tip 2, the doctor shares your values and they know what your goals are. Now in tip 3, you need to be able to help the doctor understand what kind of an environment and support you need if you're going to be successful taking their help to solve your problem. Your doctor doesn't know where you're likely to fail. Your doctor doesn't know where you're likely to stop following a process. You need to be able to understand where those things are likely to happen and make sure that your doctor has systems in place to support you before they do. Your doctor needs to know what's likely to slow you down. The only way they're going to know that is if you know that. You're not going to go to a doctor's office where they sit with you for 30 to 45 minutes and ask, so what are the things that are likely to get in the way of your success, Mr. Smith? That's not what they do. You need to come in aware of those things and share them with the doctor. So simple examples of that are the ones I just described. What you want to be able to ask the doctor is, do you have anything in place to be able to help me navigate these difficult situations that typically set me off and send me back to my ground zero of pain that I've been in? If they say no, that's okay. Ask them if they have somebody who they can refer you to who can support you on that side of the deal. They can provide you with the primary support if they're the right person for it. And then they can refer you to somebody who does have the time and does have the personal development skills to help you navigate those complicated situations in your life, like a health coach, a personal trainer, a fitness coach at a gym, anybody. They would know. It's not your job. That's where you put the burden onto them. Remember, you clicked on this video because you want to get better results from your doctor to get out of pain without pills, shots, surgeries, or copious amounts of rest. Tip number 1, make sure that your doctor is aligned on the values that you have. They live an active life just like you do, or they want to, just like you do. Tip number 2, make sure that your doctor understands specifically what your goals are for the outcome of their treatment, including how you want to get that outcome. I want X without Y. Can you help me do that? Tip number 3, make sure that you go in with a list of things that are likely to get in the way of you being successful long term, and ask the doctor if they have systems in place to help you as you navigate the journey of going from a person in pain to a person who is not. Remember, your doctors do have your best interest in mind. It's just that oftentimes they don't know how to solve the problem that you're presenting to them without their script pad, their needle, their scalpel, or rest. You need to be the one who's driving the ship, and the doctor needs to be the one who's supporting you, not the other way around. If you like what you heard today, like and subscribe. I'm Dr. Sean Pastuch, and you get the opportunity to live more and hurt less.